it? All right, it's on. Right? Can you guys hear us? Yeah, it's on. Okay.
Wonderful.
Hi, so I'm Lauren. I'm Ashlyn.
I'm James.
And I'm Ellen.
And we're doing our presentation today on medication administration and safety surrounding that.
So the target population for this presentation was the senior citizens of Windsor, age 55 and above at the Windsor Senior Center. We chose this population for a few different reasons. First one is that aging affects how your body handles medications in a lot of different ways. It changes everything from really how your body absorbs medication to how it uses it and then how it then removes it from the body. Seniors are likely to have multiple medications, which can make things confusing and potentially overwhelming, when you have 5, 6, 7 different medications to take throughout the day. 12 to 59% of adults make mistakes when handling their own medications, and that risk rises to near 75% in the elderly population. Elderly patients with more than 2 issues that require medications are at higher risks of making errors, with one study showing that 4% make more than 4 errors a year. And also patients with asthma, COPD, or diabetes are at higher risk for errors due to needing additional equipment. Just dealing with all the additional equipment like glucometers, lancets, oxygen, insulin syringes. There's a lot of small ways that mistakes can be made.
All right, so I just kind of wanted to talk a little bit about what exactly medication errors are. In a monograph cited by WHO, so the World Health Organization, they kind of defined it as any preventable event that may cause or lead to inappropriate medication use on a patient or cause harm, and the medication could be in control of a healthcare provider, a patient, or a consumer. So such events may be related to professional practice, healthcare products, procedures, and systems, including prescribing, order communication, product labeling, packaging, nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and use. That's a really big and kind of wordy definition. WHO also noted that they found about 26 appropriate definitions and that there's not really one exclusive definition of a medication error. So before we go on in the presentation, does anyone have maybe a guess as to an example of what a potential medication error could be?
Forget that you take the medication.
What's that?
Sometimes you forget that you take the medication.
Absolutely, yes. Forgetting to take a medication is a very common medical error, especially because when we're moving quickly throughout the day, if you have a routine you're going through, maybe you're running 5 minutes behind, that's a very easy thing to forget at really any age. So that's a great example of a med error. Any others?
Taking the incorrect amount of a medication.
That's another good example, taking the incorrect amount. So we have a couple examples listed here that I'll just read out. So taking a daily medication twice in the same day, so in the same way that you may forget to take it. You may also forget that you've already taken it. I know I've done that before. Skipping or forgetting a daily medication, taking a medication at the wrong time or too soon, mixing yours and a partner's medication up. So if you live at home with someone else, it's very easy to confuse medications that may look alike. Taking medications that interfere with other prescriptions can happen too. Taking expired medications, taking too much or too little. There's so many examples. So we'll move on to the next slide.
So we just wanted to assess to see how this problem may be affecting you. So I have a little pop quiz here. I don't know if I have enough for everyone, so if you want to share, that would be great. I'll pass them out here in a second. So we just want to assess, how are you quantifying your medication errors, how this might be affecting you all specifically, what kind of medication errors you guys are having and maybe experiencing in your recent lives, and what, if you did have a medication error recently, what was a contributing factor to that? So I'm going to go ahead and pass these out, and when you finish, if you could just raise your hand and I'll collect your quiz. Would you guys like to participate? Here, I'll give you guys 2 and you can share. Does everyone have pens? If you need pens, or if you want to share with a piece of paper. Would you like to take a quiz? Great. Would you like to take one? Would you like to? Yeah, sure. Can't do it. Would you guys like to take one? All right. Now you need this.
That'd be
So whenever
cool.
you finish your quiz, if you just raise your hands, and I'll go ahead and collect it.
Finish it up. I don't have a pen, so finish it up. Yeah. And then I'll read it and. Oh, yeah.
Does anyone need a pen?
Yeah?
Just want to stay pause here for a little bit.
Yeah, we'll just give everyone just a little bit of time so they can finish their quiz. So as Lauren described, there are many different kinds of medication errors. Some examples could be, as Lauren described, you forgot to forget your prescription, you forgot to take that medication during the very specific time that you were allocated to take it. Maybe you couldn't remember if you've already taken it and you take it twice, so that would be an overdose. Or maybe you forgot totally if you took it or not and you decided, I can't remember if I took medication or not, so I'm just not going to take it today because I don't want to take two if I did. You took the wrong medication, maybe it was your partner's medication, or maybe it was a bunch of medications you have. Maybe you're on a lot of different medications and you mixed up your own medications. Another really common reason is that maybe you just don't fully understand why you're on this medication. Maybe you didn't have that sit-down conversation with your prescriber or with the pharmacist. You just don't really understand why are you even on this medication. Maybe if you don't fully understand it, you decide not to take it, not to pick up that prescription at the pharmacy. Feel free in question 3F to fill in another reason that we didn't give you. There's tons of different reasons why. We'll just give everyone a second.
All set here.
All right, thank
When
you.
you are all set, just go ahead and kind of
Raise your
flag us
hand.
over so we can take your paper.
Thank you so much for today. Thank you so much. I appreciate it. Thank you.
Finish it. Yeah. We have to do the back. The back. We have to do the Okay.
If you are sharing pages and you wanted to put two persons' information down, that's totally fine. If you just want to separate it by a comma, or you can circle more than one answer, that's completely fine.
Thanks so much. There's just one more. Thank you. No, this will be better.
Good taste, good.
Thanks so much. All right, that completes our quiz.
Thank you very much for
Thanks
working
for
on
your
this, guys. We appreciate
participation.
that. So just to go over the problem again, medication errors are a common problem, both at home and in the healthcare setting, with the rate of error increasing with age. We talked a lot about the most common errors, but it is important to point out, these can be really small things. Something as simple as, like I took an extra Tylenol. I was supposed to take 2, I'm going to take 3. That's medication error. So you're a diabetic, you have to give yourself insulin. You're having a little difficulty with the syringe, you gave 9 units instead of 10. That counts as a medication error. So then the specific nursing diagnoses we chose for this was deficient knowledge related to insufficient information and insufficient knowledge of resources as evidenced by appropriate behavior and inaccurate follow-through of instruction.
Alrighty, so we identified this health need. We essentially wanted to decrease the amount of medication administration errors for the senior population, and that applies to a Healthy 2030 objective. So Healthy 2030, how many of you are aware of this Healthy People 2030 website? So our classmates are definitely aware of this because we've had it repeatedly drilled into us. But Healthy 2030, if any of you are aware, it's actually something that our CDC, our government, I know, has put in. So there's this program put in place where we have goals for the future for the overall health of our population. And Healthy People 2030 kind of defines those goals for us so that we know what, as healthcare professionals, we want to work towards for our community's health. So the goal that we have decided is to reduce the proportion of older adults who use inappropriate medications. And upon completion of this teaching that we're going over with you, we would like you to be able to teach back 3 ways to reduce medication errors for yourself, for your own safety in your home, and what you can also pass on to loved ones, so that we can kind of reduce these errors and improve overall health. So, before we even move on to that, like James was saying, we wanted to kind of go over how easy it is and how common it is for medication errors to occur. They really can happen to anyone. Like we had mentioned, pills can have similar size, shape, or color. Labeling can be confusing, or instruction can be confusing. We can be rushing or going through the motions. Some medications can even have similar names. So we put an example here of Pitocin and Pitressin. It's okay if no one can think of any other examples, but has anyone ever seen medications before that they're not sure they think might look alike? Any examples? Yes? You have? Okay, awesome. Yeah, so it's definitely something that happens commonly. There's so many different medications out there, and there are also different names for medications with the same chemical makeup. So it's easy to get them confused, and it's always okay for you to ask questions if you are confused or if you have additional questions. Also, something we wanted to talk about, there may be a need for something called medication reconciliation. Anyone familiar with this term? It's a big term for a simple concept. Our classmates are familiar with it. So I wanted to kind of discuss with you what that is as well. Medication reconciliation, we call it MedRec, is a process that should be done whenever you see your healthcare provider. So when you begin to take more than one medication, there are times when these medications can interact, or there may no longer be a need for a previous medication. The purpose of MedRec is basically just to ensure that all of your current prescriptions are accurate, up-to-date, necessary, compatible, and not redundant or excessive. So when you go to your doctor and they ask you, are you on any current medications, they're doing this to ensure that all of the medications you're taking are compatible and necessary. Any questions about that? Cool.
All right, so we're going to discuss some ways that these med errors can be prevented. How many of you have a medication list? A few hands? Awesome, perfect. So keeping an updated medication list is a great way to manage your meds. This should include your prescription brand name and the generic name, why you're taking the medication, the dosage, how often you take it, and the phone number of your pharmacy. You want to always update and share this list with your provider or any other medical professionals you may see. If you were to go on Google and type in medication list, there's many templates as well, including all this information. Like the example up here, this even includes the time of day that you would take that medication as well. I feel like if you were to ask your provider for a list as well, they could help you out with that if that's something you needed help with. You want to always keep track of your expiration dates. Expired medication will not provide the intended benefit and may even have the potential of causing life-threatening situations. You want to make sure that that's on your med list as well. You want to store your medications properly. How many of you are aware that certain medications need to be stored in a certain way? A few hands, okay. If medications are not stored properly, they may not work as well or can cause harm. Information on your medication bottle will instruct you on how they should be properly stored. Some things to consider, for example, are the temperature of where they're being stored. You know, if they're in a room, your bathroom can get very warm with the shower. That can cause some issues. Some meds need to be in the refrigerator, or like things be stored in a cool, dry place. You want to take your medication as prescribed. Take it on schedule and how your provider instructs to you. And as always, you can always ask your provider questions. If you have any side effects from meds or any further questions, concerns, you always want to consult with them. You want to make sure you know how your medications interact and what the potential side effects are. Another thing I wanted to talk about is how you dispose of your medications. Has anyone had to dispose of either expired medications or something they're not using anymore? Or do you just kind of hang on to it, keep it on your shelf? When your medication is expired and you're no longer taking it, it's important to dispose of it in the correct manner. There's several options. For the town of Windsor, there's a drug drop-off box at the Windsor Police Department, which is this bright red box photo. It's right at the opening of the police department when you walk in. This can be used for over-the-counter medications, even pet medications, and lotion and ointment medications. There's also local drug take-back programs through the prescription monitoring program. Although there's none currently going on in Windsor due to COVID, you can go to their website or you can contact them at 860-713-6073 so that you can see if there's any events being held in surrounding towns. If neither of those options work for you, you can always put them in your household trash, but there's several steps you need to take to dispose of them properly. As you can see over here, this is from the FDA. It says mix, place, throw, and scratch out. You want to make sure the personal medication on your prescription bottle is completely crossed off, and those prescription bottles cannot be recycled. They have to go in your normal trash. You also want to make the medication unappealing. You can put it in hot water and then cover it with coffee grounds, salt, cat litter, dirt, etc. Because if someone were to be digging through your trash and find a medication, who knows what could happen to it, you know. They could take it, they could try and sell it to someone. There's tons of things. You want to make it look unappealing. And then you also want to contain and seal the medication. So in this example, the medication bottle is completely scratched out, thrown away empty, and then the meds themselves are sealed in a plastic bag with dirt or something on top of them, etc., to make them unappealing. Oh, and do not flush. Completely forgot that. You never want to flush your medications. Flushing medications can increase the chance of them entering your local water system, which is your lakes, streams, rivers, etc. This can cause the ecosystem of the water to change and the physiology of the aquatic species to alter over time.
Great. So if you remember that quiz that we did, this is your data live and in person. So I've already updated your data onto this slide. So out of the 9 people that participated in the quiz, 4 of you have experienced a recent medication error. And what does that data mean? It means it's a much more common problem. We already knew it was a problem, but it looks like just here in the people today, it is a current problem. So hopefully this presentation serves well and you learned something today that can help you mitigate some of those medication issues and administrative errors that you're having. Of the 5 people that experienced a recent medication error, 1 had 1 error, 1 had 2 errors, 3, 4, and 1 person had upwards of 5+ errors in recent history. So
Easy, right?
Yeah.
We talked about how easy it is for these errors to occur.
Right.
It's a very common thing.
it's a common thing. So this is no, offense to any of you. It's something that not only the elderly population is experiencing, but everyone. I can admit myself that I've had a medication error myself. So also, I wanted to share a couple of things that you guys wrote into the other section, because you even thought of more medication errors than we did.
Good job, guys.
So good. So there was one person that said they take a medication every other day, so alternating, and they forget whether it's the day that they're supposed to take the medication or they're not. So I can see how that can be really confusing. You go, oh, am I supposed to take this Monday or Tuesday, or what day is it? That's for sure something that can definitely mess you up. Another medication error, another thing we didn't think about, is if you're allergic to a medication. So you were prescribed a medication that you forgot to tell your prescriber that you're allergic, or maybe you forgot you have that allergy, and lo and behold, you have a prescription in your house that you're allergic to. I can see how that could be a not good outcome for you. Another one, in terms of why these medications are happening, so maybe some of the reasons that are contributing to your medication error. 2 people put that you have a busy schedule, you have a really busy day, and that your schedule can conflict with either the time you're supposed to take your medication, or it can contribute to just maybe some of that memory loss, and you're not sure, where did that fit into your schedule. So thank you so much for participating in the quiz. This is really helpful and valuable information for us, and hopefully it serves you well. Yeah, so I'll wrap it. Sure, that'd be great. So Lauren's going to hand out a pamphlet that we've made. Again, I'm sorry I didn't bring enough for all of you, but maybe if you want to share. This is just, again, going through some of the material that we went over today. Studies show that medication errors in the home are very common, especially in the elderly. And we're finding that in our studies and research that number one reason why people are having medication errors is due to lack of information and education. So it was due to just maybe not having that proper conversation with your prescriber or with a pharmacist to really learn why you're on that medication, why you're supposed to be on it, when you're supposed to be taking it, and the administrative directions that go along with that medication. We found that there's increased medication errors with the more medications one person is on. So we know that in the older population, you tend to maybe be on a bunch of medications, and that for sure can be really confusing. We also found that increased medication errors happen with increased age. So as Lauren went through before, there's a number of different medication errors. You thought more than we did. And then also, as Ellen described, one of the medication errors that really happens commonly is taking an expired medication. So it's really important to make sure that you dispose of that expired medication appropriately. There is a link here that can help you find out how to dispose of that medication properly if it is expired. And then we put a bunch of different things here on the bottom, ways that you can help yourselves reduce and mitigate some of those medication errors. Some organizational techniques are great, but you have to make sure that you find the organization technique that works best for you. And only you know that. So whether it's a pill box or there's a number of smartphone apps that are on the market now that can help organize. You can press at the exact time that you take it, and that way your phone can help you stay organized. Whether it's a calendar or a mid-list spreadsheet. So the number one thing that we can really advocate for you to do is just take a phone call, take a second to sit down with your prescriber, your doctor. When you go up, pick up your prescription from a pharmacy, you can talk to the pharmacist right then and there, and they'll help you walk through some of those directions and educational techniques you might need. So hopefully this is helpful, and thanks for coming today. We really appreciate it.